Hey everyone, welcome back to the channel, where we break down complex medical science into simple, fascinating insights. Today's topic is bone density testing. What it is, how it's measured, and why interpreting it properly can make the difference between strong bones and fractures. Before we begin, this video is for education and inspiration only. It's not medical advice. Be sure to consult a healthcare professional and double-check information with trusted sources. A DXA scan measures how dense or strong your bones are. It's used to diagnose osteopenia, osteoporosis, and estimate fracture risk. Two major numbers matter. T-score compares your bone density to a healthy 30-year-old. Z-score compares your bone density to people your own age, sex, and body size. Here's the T-score breakdown. Normal is a T-score above -1.0. Osteopenia is a T-score between -1.0 and -2.5. Osteoporosis is a T-score of -2.5 or lower. Now here's where it gets critical. If a patient suffers a fragility fracture, meaning a break from a simple fall, it totally changes how aggressively we need to treat. Let's break it down. If the T-score is -3.6 or worse, meaning -3.6, -3.7, -3.8 and beyond, even without a fracture, that patient needs aggressive treatment with Forteo or Tymlos. If the T-score is better than -3.6, say -3.2 or -2.8, then Forteo or Tymlos are only used if there has already been a fragility fracture. Forteo and Tymlos are called anabolic therapies. They actually help build new bone, unlike most other treatments that mainly slow bone loss. Now here's a major pitfall with interpreting DXA scans. Arthritis can fake better numbers, especially in the lumbar spine. If arthritis is present in the lower spine, like L3, L4, and L5, it can artificially raise the T-score. That's why you should focus on the vertebral bodies with the least arthritis, like T12, L1, or L2. When reading the spine report, pick the vertebrae with the least degeneration for the most accurate bone strength reading. The hips are another critical site because arthritis doesn't usually interfere there, making the hip T-scores often more reliable. And here's another tricky situation. If the patient has scoliosis, the bone density on the convex or outward curved side of the spine can be lower. Always interpret scoliosis-affected bone density with caution. Another important tip: the forearm is made up mostly of cortical bone, just like the hip. So forearm bone density often correlates with the hip. If a patient has severe osteoporosis in the forearm, but only osteopenia in the hip, treatment may still be needed. In other words, don't ignore the forearm. Especially in severe osteoporosis cases, the forearm can reveal a need for aggressive intervention. When making treatment decisions, it's the single lowest T-score that matters. It's not about the cumulative average of the spine or hip. It's whichever site has the worst number. And one last tip, you'll see something called the Ward's area on your report. Ignore it. Ward's area doesn't correlate well with real fracture risk. So to wrap up, know your T-scores and Z-scores. Always ask if arthritis or scoliosis are affecting the results. Pay special attention to the hips and forearm. Focus on the lowest T-score. Ignore the Ward area and treat aggressively when needed, especially after fragility fractures or very low scores. If you found this video helpful, hit that like button, subscribe for more clear medical breakdowns every week, and an in-depth review of Forteo and Tymlos is forthcoming. Stay strong, stay curious, and I'll see you next time.